mask. Sometimes when you take ACLS or something like that, they don't even refer to it as a resuscitator. They just refer it as BVM, bag valve mask. The bag itself has to be flexible. It has to have a non-slip kind of surface because sometimes your hands do get wet. This is self-inflating. You don't need a gas source for this bag to inflate. When you squeeze it, it inflates all by itself. It has to be able to do that. It has to be able to be manipulated by you. You have a valve. Yeah, imagine you have several valves. You have the valve that goes on the inspiratory side. This is where you're going to be giving the flow to the patient. Now, if you look in your textbook, it tells you there are 3 different kinds of valves we need to be concerned with. This one is what they call a duckbill. And if you look inside there, you will see why it's referred to as a duckbill. Here's another one. That's a duckbill. If you look inside
Oh,
there,
yeah. I see it.
Oh.
the way it opens and closes.
Wi-Fi.
Oh.
Yeah, no, I saw.
The purpose of this being, when you squeeze the bag, that valve opens,
Air
flow
in.
goes to the patient. When you let go, remember, exhalation is passive. When you give them a breath, you're forcing air into the thoracic cavity. But then when you let go, when you stop giving air, the lungs and the thorax attempts to regain their natural configuration. So exhalation is going to be passive. So you're going to give a breath, and when you let go, that valve is going to close so that the patient's exhale gases don't go back into the bag. They go out to your exhalation. And each one of these bags have to have some kind of exhalation port where the patient exhales their gases. You also have several valves on the bottom of the bag, and I think the best way to demonstrate it is with this little guy here. Okay, so this is inhalation. Exhalation is around here. Now down here you also have a valve in here. The purpose of that is you're always, when you're bagging at a code, you're always going to have oxygen attached. This is your port where your oxygen is going to be attached. It's going to be attached to your flow meter. The liter flow that you have it set at will depend on the size of the bag. We'll get back to that. And then you have this big port here. This is for your reservoir bag. The reservoir bag, what's over here? Your reservoir bag fits on. Reservoir bag fits on here. What happens is when you give a breath and you squeeze the bag, this valve closes. This valve opens. When you let go, this valve closes and this valve opens so that your oxygen can now go in and fill the bag. But you can also suck in room air from here, which is going to compromise your FiO2. So by having this reservoir bag on the bottom, now when you have your flow going into your bag from your flow meter, it's not only filling the bladder of your bag, it's also filling your reservoir bag. So now when you let go, the bag is going to refill not only with oxygen from your flow meter, but with the oxygen from here, and that's guaranteeing your patient close to 100% oxygen. Because when you're doing resuscitation, you want your patient to get 100%. If you do it this way, without the reservoir bag, you're going to have a lower FiO2. There will be instances where you maybe don't want to give the patient 100%. Like if your patient is on a ventilator and you get ready to take him down to CAT scan, but your patient's on 30% oxygen. Why do you want to give him 100% when you transport him? You don't. You take the reservoir bag off. Now, you don't know exactly what FiO2 you're giving, but you know it's not 100%.
Not 100, which is good.
Huh?
But that's good because you're not getting 100.
Right. Right. So, this is your duckbill. This one is called a leaf. As you can see, it has a completely different configuration. When you squeeze the bag, the leaf opens, so the flow goes to the patient, and then it comes down and closes, so exhalation comes out the top here. You see the difference? The leaf is here. This old one here is a spring. Now, I had a better one, but I can't find it, so I borrowed one from Fitness. But it has a spring and a ball in here, or sometimes it has a spring and a disc. And you can actually hear it. When you squeeze the bag, there's a spring in there. It pushes the ball up, which closes your exhalation. When you let go, it falls back down. so that the patient can exhale out the top. It's important for you to know what kind of valve you're working with and to know when whether or not that valve can get clogged with like mucus or blood if your patient is coughing, and how quickly you can clean it out. So like if I'm using this little one here, I know that I can just open this up and take out any mucus. But a lot of times you just want to like throw it away and just grab me another bag. And sometimes, in a cold situation, you don't want to be playing around with these things.
Do you take multiple bags with you when you go in? Like, should you have like a backup one?
When you go to a code?
Yeah, like do people do that?
When you go to a code anywhere in the hospital, there should be several bags hanging on the crash card.
Text them because they're
Okay.
too
Every
long.
machine
I'll put them on
right?
YouTube.
Huh?
Usually too, like sometimes they have
At
it in
least
a
two.
room.
There should always be bags hanging on your crash card, at least two. And you may have noticed if if you guys have been very observant, but in the hallways, there's bags hanging at various spots because sometimes the patient may code in the bathroom, on the floor.
Is that
in
called the
hallway.
bag?
Huh?
That whole thing is called the bag?
Yeah, the whole thing.
Not the actual bag.
No, the whole thing.
Yeah, that's why I was like,
You mean the reservoir?
Yeah, yeah.
No, the whole thing is just referred to as the bag.
Okay.
It'd be the bag valve mask.
BVM.
Okay, so this is your infant version or infant neonatal. Notice it's very, very small.
Mary, the leaf
What's it called?
and the
BBM?
what's the other one called?
Duckbill?
Duckbill. That's really just hospital's choice on which ones they carry. Or,
Yeah.
I mean,
Yeah.
they're going to do the same thing.
They do exactly the same thing. What happens is the hospital orders from a specific company.